Welcome to InnoHEALTH.
Thank you.
Could you tell us about yourself?
I am Dr. Gaur. I run an organization called Oncquest, which is into high-end diagnostics, especially molecular oncology, where we work on personalized medicine, and that's something what we are talking today, where the treatment is more precise to the needs of an individual, not of the community. Because every individual is different and every individual has different genetic makeup. They come from a very different environment. So the treatment has to be different. It can't be same like over-the-counter pill you pop up and that's it. And that's what exactly I do. I analyze more of the blood samples, or especially in cancers, genetic testing, where every tumor is different. So how do we identify genetically the makeup of the tumor, and based on the tumor makeup, we advise clinicians that this is the kind of medicine or chemotherapy to prescribe. That's precisely what we are.
Okay, so what brings you to InnoHEALTH?
InnoHEALTH is, I think I'm very fond of firstly called as disruptive innovation. And when we talk about the increment, that's what normally happens in healthcare. You refine on technology, refine. So the bridging the gap, because on one hand we have a very high-end technology with us. On the other hand, rural area, there's no facility. How do you bring that gap properly? And that is what it is. If you can, instead of getting the samples or tissues or information from the periphery into one central place, if you can take your lab right up to the rural area, running something like a point of care or near patient care, and that is possible today with the technology, with the IT integration, and that is what something I feel that this is a platform of InnoHEALTH. We're trying to integrate the IT guys, the digital guys, new technology, point of care, bringing them together and making it applicable to the rural area, and that's the need of the country. Interface, urban and rural interface, and which will probably help address our health challenges in India. And that's what I'm passionate about it. That's why I came here.
So what was the key you take away from the session?
Yes, the takeaway is that a lot of technologies and people are working on it. But yes, what need is the need for leadership to drive it and make that people aware of it. People are reading probably, but when it comes to the moment you step 100 kilometers out of Delhi or maybe out of Mumbai, you don't know, people don't know anything about it. How does it work? The same thing which works in metro, can it work in a remote village in the area? And this is where probably the learning is. And if you have a good interface of the service providers, the mind innovators, and the skill, and the platform probably brings that bridging gap here.
Okay.
But yet a lot need to be done probably. We need to go back to the rural areas, we need to go to the peripheral areas, we need to go probably in the monitoring space where testing is done, or information which clinicians want, which is brought immediately, because otherwise the results report come after 1 month by the time patient is already gone. So I think that's where the gap is required, and that's where probably the need is. And IT need to play a very important role, but IT cannot work in IT way. It is the healthcare people who have to integrate, and this is what I think.
Okay, so what should we do in 2018?
I think many more such conferences. I'd like to talk about actually see the demo, how the technology, whatever we discussed today, how it is working into the practice. As I mentioned probably one of my discussion, Indian environment is different. Indian people are different. Genomics is too diverse. Lifestyle is too diverse. East, west, north, south. Somewhere it's hot, somewhere it's humid, somewhere it's raining, somewhere it's cold. I think same thing cannot be applicable to everyone. Same instrument probably will not work at everywhere. So I think these instruments or technologies apply to the periphery and see the results. What really has happened, how much they have delivered, and then probably scale up the opportunity.
Yeah.
That's something, hackathon kind of thing can be organized, nothing like that.
Okay, thank you so much, sir. Please sign there.
Sign.
Sorry.